While we're talking about ACLs, I have to remember to tell you, in case I forget, I had a fascinating conversation with a guy by the name of Zim Zanelli.
Sure.
He's from Sydney. He's an athlete, a super athlete, and he's a patient of yours.
Yes.
And he told me that he had an ACL injury years ago, and the surgeon shaved the meniscus. And for the next 4 years, he had a lot of pain. And so he started going to orthopedic surgeons. He went to 6 orthopedic surgeons in Sydney. He was adamant he didn't want to have metal in his knee, he tells me. So they said, well, then the only other option is to stop what you're doing and just do swimming and a bit of cycling. Now, for him, he does martial arts. He does some form of sport every day of his life. He's like you. He's addicted to exercise. And he wasn't going to have any of that. So after 4 years of pain and 6 doctors telling him the same thing, he did some research online and he found you in San Francisco. And he went over and you treated him. And I have to tell you, I mean, I'm going to ask you what the diagnosis was in a minute and how you treated him, but he thinks you can walk on water. But believe me. And he said if he ever needed an orthopedic surgeon again, he's just hopping on a plane and going over to you. And he also loved the fact that you have a rehab clinic in your office. So I asked him, how did that work for you? He said, well, I was in a hotel right nearby. It was so easy, and I'd just go and get my treatment. So I wanted to ask you, what was his diagnosis and how did you treat him?
So with his permission, I can talk about him specifically because normally we wouldn't do that. But he's asked us to help communicate his story. So what happens in an athlete who's lost their meniscus? The meniscus is that key shock absorber inside people's knees. And they've also lost their ligament and they've lost the bearing surface of their joint. They've gotten arthritis as a result of not having that shock absorber. Now, in a young, healthy athlete like him, he requested a biologic joint replacement as opposed to an artificial joint replacement. And a biologic joint replacement means that we put back a new meniscus, a donor tissue. We regrow the articular cartilage, the bearing surface of the joint, using a technique called articular cartilage paste grafting that we developed years ago and are doing research on making even better today. And we rebuild his ACL and the extra articular ligaments on the side in order to return his joint to a stable joint. And then we train him for 2 hours a day, morning and afternoon, every day that he's here in the clinic with us. And we ask patients to stay as long as they reasonably can, and then return them to sport. And so the goal is to get someone who has a unstable knee or even an arthritic knee or a knee that's lost the meniscus cartilage and replace those missing tissues or regrow them. And we're getting better and better at doing that. And he's a great example of doing that in a driven athlete.